I'm Dr. Maury Markman from the MD Anderson Cancer Center in Houston, and I would like to briefly discuss a very interesting paper that appeared in the New England Journal of Medicine on April 3rd, 2008, regarding an experimental topical immunoresponse modulating agent that was a cream form that was used in a double-blind randomized controlled trial against vulvar intraepithelial neoplasia. This is a condition that is treated surgically. Generally, the surgery is successful, but there's a high risk of recurrence, and in this particular region of the body, there can be a lot of morbidity associated with that surgery. In addition, another important part of this particular disease entity is that it is almost always HPV related. And of course, we have very ineffective therapies to treat established HPV, and generally in the cervix or the vaginal area, vulval area, that's really surgical removal. So in this study involving 52 patients with grade 2 or grade 3 vulvar intraepithelial neoplasia, patients were randomly assigned either to receive the cream, which was a topical immunomodulating agent, or a placebo. It was applied twice a week for 16 weeks. The primary endpoint in the trial was a reduction of 20% or more in the size of the lesions at 20 weeks. The bottom line is that the experimental agent was quite effective, at least in the short term, and a very great importance in 9 patients, all who were treated with the topical agent had a complete response at 20 weeks and remained free of disease at 12 months. Again, this is still a small trial, but I think the proof of principle is that this topical agent was effective in a number of patients in apparently eliminating, at least relatively long-term elimination, if not complete elimination, of intraepithelial neoplasia that was HPV related. And obviously this is a very exciting study and a proof of principle that other agents like this can be effective in this condition, preventing the need for surgery, which can be quite morbid, as well as preventing the recurrence of the condition, potentially even completely eliminating it. Again, this is Dr. Maury Markman. I think this is a very interesting study, and I would actually encourage you to read it.